Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. And we're going to talk about exactly that today. We're going to talk about non-pharmaceutical ways to alleviate headaches and migraines. And on this podcast, I have Dr. Sarah Thomas, who's one of our other providers here. I think this might be the third or fourth podcast that we've done together. And she, which is always enjoyable because she does such a great job of researching, and her passion in helping people with headaches and migraines comes out. So thank you so much for being on the podcast.
Yeah, I'm excited to be here again. It's always really fun, and I like to have a little bit of theme to some of my episodes. I think I did a one in October that was just a little on the spooky side for Halloween. So I was trying to figure out a sort of a Valentine's episode, and I started thinking about, what is the effect of love and different things on headaches. And so that was what kind of where this came from.
Oh, that's awesome.
Yeah.
I didn't realize that. I think that this one's going to be really popular because I do think that it's fairly like a pretty common Google search to ask what are some non-pharmaceutical ways, and people are searching all over the internet for tips and tricks outside of their medication so that they can reduce their need for pharmaceuticals, because everyone knows like there are side effects and this is not addressing the source of the problem. And then you have some real data that's kind of interesting beyond what is sort of assumed or potentially what people have heard already in their search. So I'm excited for this podcast. Give us kind of an outline here, and then we'll jump into the specifics.
Yeah, so we're going to talk about 6 different areas today. And all of these areas are different ones that pretty much I think just about everyone can do to some extent. So we're going to talk about sleep. We're going to talk about meditation, exercise, different herbal supplements, relationships, and just kind of go into what the effect of each of those has on pain. And we're going to see, depending on the area, it can actually be pretty substantial in its, relief of pain or even the appearance of pain in general. That's a common question I get sometimes, is why some people have really severe pain and some don't, even though, you look at someone's lifestyle and you're like, oh, they, why don't they have the same pain I do? And sometimes it's these little things, these lifestyle factors can actually make a huge difference.
Yeah. And sleep is a big one to start off with. Let's talk about sleep and what are some insights that you have for us?
So I'm going to just jump right in, and I'm going to say right off the bat, I actually love animals. I've been trying to get more animals into the podcast, but I came across the cutest animal study it's my new favorite study I've ever read about. So this is a case study on sleep deprivation in mice. So obviously, I think it's kind of generally accepted that if you don't sleep very well, you don't feel well, but I wanted to go a little deeper than that. So what I did is I found this study that they essentially took these mice and they wanted to see how sleep deprivation impacted their sensitivity to pain. I believe it was like a cold or a hot stimulus or capsaicin, I believe. But what they did is past studies had looked at sort of sleep deprivation in a really negative manner. So they had actually put the mice on treadmills, or they had put the mice on these platforms that they would fall off of if they fell asleep, which sounded terrible and also maybe a tiny bit funny. But this study, they actually did the opposite, because when a mouse is stressed, you can also have stress impact your pain as well. So they wanted to eliminate that effect. So they actually kept the mice entertained. The mice were having fun, and they were having toys, and they were chewing, and they were just having the best, time of their mouse life, and they forgot to sleep. And I thought this was really interesting because I think this is what tends to happen more often than not when we encounter sleep deprivation in our own lives. Typically by the end of the night, most of us hopefully are not working late hours. Some of us will be, but most of us are on our phones. We're watching TikTok, we're watching TV, we're reading a book, we're chatting with a family member, and we just lose track of time and don't get enough sleep. And so they did the same thing in the study where they replicated this. So again, the mice weren't stressed. They measured their cortisol levels. They were just having a great time. But the next morning, when they tested their sensitivity to pain, they found that the mice that had not gotten adequate sleep were definitely more sensitive. They were more reactive to the pain. They moved away from the stimulus a lot faster. One interesting caveat of this study is that when they gave the mice caffeine or some other substance to wake them back up again, this sensitivity actually decreased. So they were no longer as sensitive to pain. And what the study talked about is that your sensitivity, your lack of sleep can actually increase your sensitivity to pain, and being awake can actually just decrease your sensitivity to pain. Even like I said, even if you hadn't actually had the sleep, just that wakefulness state was really important to having low levels of pain.
Yeah, which is amazing. I've had patients actually just recently that are consuming a high level of caffeine every day. And there are different mechanisms behind like why caffeine has an impact on headaches and migraines. We know that Excedrin has caffeine in it as kind of a stimulant, but this was interesting to get the perspective of the stimulant just basically putting you in more of an awake status, allowing you to manage pain or mitigate pain.
Yeah.
What might be our takeaway there?
You know, what they said actually is so common, basically with chronic pain and sleep deprivation, it's very common that those two go hand in hand. You know, you have pain, you don't sleep well. And it's typically been thought that because you have pain, you don't sleep very great. That's usually what people have assumed is the pain is first. If you're trying to figure out the chicken or the egg type of a thing, they're starting to actually think it's the opposite, where you don't sleep well. So either you're staying up too late, your sleep quality is poor due to some other reason. And then because of that, you actually experience pain. So they actually think that poor sleep may be tied to pain, but as a cause rather than just kind of a side effect of being in pain all the time.
Yeah. And then you were relating that to people that, I guess it's pretty common in our culture to stay up late just entertaining yourself.
Yeah.
And so, your point was maybe we're not staying up late because we're like stressed and can't calm down, but we're like just sort of stimulating our brain in different ways, screen time, social media, watching a movie, whatever it may be. And so we're simulating the same, the results of this study where the mouse was entertained and excited about whatever they were doing.
They were having a great time. They were watching their little equivalent of TikTok because, again, I think they were chewing toys.
They were watching TikTok.
They were probably not actually watching TikTok, but maybe, you never know. They were having a great time, but at the end of the day, it didn't really matter what they were doing. It still caused a lot more sensitivity to pain. And I think Brant did a pretty recent episode with you on good sleep hygiene practices, but it really is interesting. Your brain is going to calm down when you go to sleep. Your brain has to, unwind and decompress, and the nervous system has to calm down. So if you're continually stimulating the nervous system, it's going to be hard to relax, and then you're going to get less sleep than you need, and then the next day you can end up sort of in this pain pattern. I thought it was actually super interesting how much sleep really ties into pain.
Yeah, that's fantastic. Okay, so sleep, and then is exercise next?
Exercise
is that right?
Next. Yep.
Okay, let's chat about that.
Yeah, so exercise, not a ton of exciting. I don't have a good mouse study for exercise, sadly, but still a really interesting look. So exercise, I think no one was going to really dispute the benefits of exercise. Exercise is tied to a decreased amount of stress. And when you put your body through exercise, you are going through a physiological and a physical stress. And so what that tends to do is that actually tends to decrease your threshold for pain. Basically, it toughens your body up. Your body is a lot less sensitive to pain when it's used to, say, like picking up a heavy weight or doing a run. You, to an extent, like I said, you have to get used to a certain degree of discomfort. And so then that can make your threshold much higher for pain. Again, decreases stress. A really interesting thing tying with our last one, I saw this recently that they said, when you are sedentary all day, you just don't use all your energy. That's a bit of a layperson way to describe it, but it can actually be really hard to fall asleep at night because you've just sat all day. You haven't really exerted yourself, and your body doesn't really need to rest per se at the normal time, and it can be really hard to fall asleep. Exercise actually helps negate this, where you do exert yourself and you lift weights, you run, you swim, whatever your exercise of choice is, but then it can make it so much easier to fall asleep because you've essentially kind of worn yourself out at the end of the day.
Yeah, absolutely. I like the idea of good stress and bad stress. And so the bad stress is leading to sort of a damaging effect on the body. Sitting is a form of stress that it doesn't utilize, like you're saying, all of our capacity that we have throughout the day. So whether that's like the amount of energy we have available to us, but when we think through a physical therapy lens, it's just like your joints, your muscles, your tendons, like we're intended to move, and so we need to move, and so exercise is a good type of stress on the body because it leads to a higher threshold. So I think that's a really good point, and we need to be pushing ourselves in the right direction so that our threshold continues to climb. And the amazing thing about the body is that it allows us to get the benefits of the good stress of exercise until we die. Like, so we can always improve, and our tissues and the cells within our body will always respond positively to stress, which is an amazing thing.
Yeah, I actually remember a few years ago seeing a study where they, there's a certain, I think, thought that once you hit a certain age, exercise isn't worth it or you won't see any benefits, which is absolutely not true. I've done a lot of work in geriatrics up until now. And they actually did a study where they were able to show, I think, 90-year-old men building muscle with exercise. And yeah, you're not going to be like a bodybuilder, hopefully, but you can still at any point in your life see benefits from exercise.
Yeah, absolutely. On the other end of that, we have is meditation.
Oh yeah,
on
we
the
can
list.
talk about meditation. Yeah. So meditation that was kind of a surprise to me because I think there's a really big focus in our culture, and I'm not opposed to this at all. I think it's really good, but mindfulness and meditation, I feel like, are very, I would almost go so far to say is kind of a buzzword these days of being mindful, being in the moment, all of which are great things. So I actually expected this one to be kind of a no-brainer. As far as, yeah, of course, being mindful of your pain and, sitting down and readjusting your brain and everything is going to alleviate pain. The studies are actually mixed on meditation when you look at it. There are some studies that show meditation does lower stress, lower pain, lower levels of depression, etc. But the studies are a little bit mixed, and the mechanism's a bit unknown as far as meditation. There were some studies that indicated perhaps that meditation helps you kind of rewire your brain essentially a little bit as to, we've talked in the past about central sensitization with chronic pain. So there's some indication that meditation maybe can help with the nervous system a bit. It may also help trigger some like an opioid type of a response, just a natural opioid response in your body, so natural pain relief. But I was actually surprised that I think meditation is certainly not a bad thing, but the studies were a little bit mixed as to whether or not it was a really good pain relief or not.
Yeah, and I've had providers on this podcast that have most of their platform based on meditation. So anecdotally, like it's I would say slowing down and creating space, and whether that's like prayer, meditation, I guess kind of pick your mode, but it's I think across the board you're not really going to experience like negatives. And so there's certain things that we don't need to be overly critical of. And so the things that we need to be overly critical of are the things that are harmful to our body. And so I think the theme of this podcast being non-pharmaceutical ways to help, we should be more critical of the pharmaceuticals because they do in some sense harm us. And so, but when it comes to something like meditation, we don't necessarily need to be super critical of it. So whether there's a robust amount of evidence or not, I would say it's generally acceptable to be a good practice and something to implement. And so, I think rolling that in, mindfulness, meditation, it's becoming more and more popular in a conversation. So definitely a good practice.
Yeah, I think it's very important to point out. I agree with that completely. There's no real bad side effects of meditation. Even, you can certainly give it a shot. And if you don't like it and it's not for you, not everything has to be for everyone. And certainly I've seen plenty of people that absolutely love, that slow down and everything. So I agree completely with that even if the studies are a little bit mixed, it's never a bad thing to try out. And like I said, if you don't like it, you just lost, maybe 20 minutes of your life instead of having really severe medication side effects. So I agree with that completely. And going along with that, if meditation is not your thing, or if something else is, you talked about slowing down, and being more mindful. Actually, hobbies are another one that can be really tied with pain relief. So maybe meditation's not your hobby, but you can also maybe do something like gardening or yoga or art. And all of these are associated with a couple of really great things for pain relief. The first one is many hobbies are active. Not all of them are, obviously, but most hobbies involve some sort of movement, which we've talked about with exercise and sleep. Both are really good for promoting a really healthy sense of movement, getting your body kind of moving and then helping you fall asleep later at night. So that's a really great benefit of hobbies. Hobbies are also associated with a kind of a greater sense of purpose. I think people that just go to work and come home and watch TV and go to work and come home and watch TV, there's nothing greater you're striving for. So a lot of times a hobby can really give you a greater sense of purpose in life. And if nothing else, they say it actually helps just distract from the pain. So if you're focused on your hike and how beautiful it is, or you're painting a picture, you're not really thinking about your pain very much. So there can actually be some really excellent benefits to a hobby, even just as a distraction, if nothing else.
Yeah, absolutely. Yeah. And I think, definitely a healthy practice, and getting, hobbies that get us outside, hobbies that put us in front of other people. So many benefits. One other thing that I found fascinating that I'm excited to get to is, what you found with herbs.
Yes.
And like essential oils and some of those natural remedies that are probably questioned by a lot of people, but then utilized by a lot of people. And I would again put them in the category of like definitely worth a shot. And maybe there's some, you'll go into what you found, but anecdotally, if your experience like with something like an essential oil and a diffuser is positive, then keep going. But what did you actually find?
Yeah. So moving on, I was going to say, I think this is probably a good one from hobbies, because I do feel like the essential oils have become such a big industry, and I would go so far as to say a hobby for a lot of people. So a lot of essential oils, so we're talking like natural herbs and supplements, they are associated with a reduced level of inflammation and decreased pain. I'm not going to go into every single, I actually was starting to list, lavender has these benefits, and it was pretty much the same every single time. It was reduced inflammation and reduced pain for a lot of these. I'm going to give a really fast disclaimer. Just, I think on any medical podcast, we want to be careful. Our audience is very vast. We don't know our individual audience. So what I'm about to say with the herbs and supplements, not all of these are appropriate for every group of person. For example, some of these, if you're pregnant, would not be safe to consume in any form. So when we're going to talk about this, just please keep in mind that you need to do your research, probably need to talk to your doctor before you start any supplement, just to make sure it's not going to have any negative impact with any other medication you might be taking. Some of these are ingested, some of these are a powder, some of these are an oil. So you certainly also need to do your research as to how to consume these, and then always make sure you get them from a reputable dealer. So that being aside, so disclaimer and legal aside, yeah, there are a lot of herbs that have some really great benefits. It pretty much, I found just lists of dozens of different ones that are associated with pain. So I focused my research primarily on what was good specifically for headaches. And this is not an exhaustive list, but I came up with 7. So we've got lavender, which is one of my personal favorites, rosemary, coriander, ginger, feverfew, peppermint, and willow. So all of those, I know willow was, I believe willow is actually where ibuprofen or Tylenol, I think it was ibuprofen, was synthesized from. So that's pretty cool. And then ginger was actually one of my favorites because they did a study. So this is actually a study. This isn't just anecdotal. They found that ginger and sumatriptan had about the same effect. I think it was ginger powder specifically, but same effect as each other. And obviously ginger is going to have a lot less side effects than sumatriptan, which I found super interesting.
That's amazing. Mm-hmm. I think sumatriptan is one of the most commonly prescribed medications for headaches and migraines. So I'm sure a lot of people listening to this have, their sumatriptan prescription and are taking it, somewhat regularly. And so that's amazing. Ginger powder specifically. Mm-hmm. So give it a shot. I think it'd be fascinating if people implemented some of like ginger and saw relief. Like, please let us know.
Yeah. Love it.
send us an email and give us feedback of like, hey, that was super helpful.
I know
That'd be amazing.
anecdotally for me too, a lot of my patients talk about peppermint oil specifically.
Yeah.
I think they rub it on their temples. Peppermint's another one I hear a lot about. Feverfew, there were a few that I hadn't really heard people trying. But yeah, and like I said, this is not an exhaustive list. I think the list I took this from, I think I only even listed like half or even, I mean, there were stuff I'd never even heard of. There's a lot out there. And again, many less side effects than your typical medication is going to have.
Yeah, absolutely. And very accessible too. I mean, I'm assuming a lot of these would be available at Sprouts or Natural Grocers or Whole Foods or something like that. But should be very accessible to get a hold of. Like no prescription needed.
Oh, no, yeah.
And that speaks to the really the safety of them. Like the risks are much lower. So again, something worth giving a shot.
Yeah. Like I said, for most people, certainly can't hurt. Do your research just to be sure. But yeah, certainly, again, a much safer option than a lot of medications. Last one we're going to talk about, and this is kind of the area I think that initially inspired this episode, because I was really curious on the effect of relationships with headaches. I'd kind of tentatively heard probably some things over the years about, relationships helping or hurting pain, but I did research on both your relationships with people and then your relationships with your pet. So I'll go into the people first. So a couple of studies that I looked at. One was a study where they had couples. I think they were a certain amount, they'd been together for a certain amount of time. And I can't remember off the top of my head, but they would put a lot of, I think it was like a cold or like a heavy pressure stimulus on one of the partners. And then they would measure their response to the pain. And what they found is that couples that were in a loving relationship, if your partner was present, you were much more likely to say that the pain was lower versus if your partner had left the room, you were likely to say that the pain was higher. Another study showed, or it might have been a series of studies, showed that for chronic pain patients, having a really supportive family dynamic would help either not have the chronic pain develop at all, or if it did develop, you were much more likely to go into remission, essentially your pain going away. So there's a lot to be said for having really positive relationships and its effect on pain. Sadly, the converse is also true, whereas if you don't have, if you have a relationship that is very fractious and negative, it can actually increase your pain as well.
Yeah. The thing that you haven't mentioned yet, which I think you're most excited about, was not the relationships with people necessarily, but the relationships with different type of companion and animal.
Animal.
Tell us more about that.
I know. I'm an animal lover, like I said at the start. I do want to say one more thing about the relationships with people. We are not advocating for you to break up with your significant other. If they are causing you pain, don't break up right before Valentine's Day. Actually, I think this episode will come out just after. So maybe it's okay to break up then. But but yeah, pets. So ton of research and ton of, I think, anecdotal. People love dogs. I think especially in this country, people love their pets just almost to a degree that's sometimes a little alarming to me. But they've done a lot of studies and they can show that dogs especially do substantially decrease your pain. So one fun study, if anyone has ever had a joint replacement, that is a pretty intensive surgery. I used to rehab a lot of those before I started working with Novera. And that, especially total knees, are very, very painful. Don't skip them, by the way. If your doctor recommends them, they're usually pretty good. Outcomes are usually very good, but they're a pretty painful surgery. And they actually did a study where they had a dog in the waiting room, and you would spend like 10 to 15 minutes with the dog, and then you would go do your physical therapy appointment. And what they found is that if you spent that time with the dog, you were much more tolerant of your PT appointment. You had a much higher pain tolerance, which I thought was really interesting.
Yeah, it's fascinating. I haven't heard of too many clinics that I have heard of a couple that implement some sort of like therapy animal into the waiting room. My
mom's cardiologist has a dog. I don't know which office it is. I'm not going to shout it out, but my mom's cardiology office has a dog running around.
Yeah, that's amazing. Maybe that's something to think about. Relationships. We've had people that have trauma in their past, and this might be a little bit of a tangent, but it feels like the negative impact of bad relationships definitely carries over and like sticks with people. So that is something that is important for us to understand when we're starting to treat someone and help them out of this situation. But when I say help them out of the situation, it's their migraines, not their relationship.
Not advocating divorce again. Saying it a second time.
Yeah, and then people that have a really good support group, again, tend to heal. And part of that might be the opportunity that they have for accountability. And so when someone's going through a process, I tell people that we sell crock pots, not microwaves. And so it takes time and it's effort involved in our process. And then you have to own it. You have to own the changes in your own life. So having someone that keeps you accountable, having a good, healthy relationship definitely leads to better outcomes in what we see. And then, yeah, we don't have a therapy dog in our waiting room yet.
But we should get one.
Yeah. I agree with you that there's maybe a bit too much love for dogs, and I don't dislike dogs. I'm definitely more of a dog person than not. But yeah, having a dog constantly in the waiting room, it feels like a big next step. But I love the idea of that being therapeutic, and it totally makes sense. Like we all, dogs are great.
Yeah, there's the last study I'll just talk about actually. I just gave it a little bit of why dogs may be a little bit better. Even I actually found a study that said dogs are better than people as far as pain relief. They said that essentially you may, even if you've got a family member or a friend that you love, you may still be a little bit concerned about, they might judge me. What are they going to think? Whereas your dog, you look at your dog as a very non-judgmental entity. I'm sure there's some exceptions, but most dogs are just, I feel like, there to love and be loved. So there was a study that actually said that they found dogs had even a greater impact on pain relief than people did, which I thought was super interesting. And I do think that highlights the importance of, obviously any of these 6 things can be done. But circumstances may vary. Again, we're not advocating for you if you've got a bad relationship to just ditch it. We're not saying you need to pick up 20 hobbies, but I think you should look at what you can control. So even if you do have a few things that maybe are in more of the negative category, you can also look at these and say, should I get a dog, or should I go out and maybe socialize and build a bigger support network with, even if maybe my home life isn't great, maybe I can get some friends or some family, some church, kind of any social group in general. There's a lot we can control, even though maybe everything isn't perfect.
Yeah. And what I'll do to, again, relate this to, or maybe zoom out and give perspective. These changes are really essential. So, again, not to the extent of you need to have, 20 hobbies, or you need to be in a good relationship, or, there are things in life that we can control. And so the things that we can control, if we are working with someone that's like, I don't want to change this area of my life at all. And so if you are someone who wants to take ownership and make these changes, we want to work with you, because you are the type of person that will find great success with our process. And sometimes these things have a dramatic impact on their own. And then, but oftentimes it needs to be partnered with a provider that can help guide, and then a type of treatment that allows the body to function the way it should. And that's where we step in. But if you are someone who is just eating this list up, and you're like, man, I'm going to take action on this, you are the type of person that we want to work with, because you're someone that, when we talk about results, and it's about 80-80, 80% of the people that go through a process, we find are getting about 80% relief. And so when we, the 80-80, a big factor in that is really up to you and your ability to take ownership of your own life and make these changes. And so if that's you, that's who we're looking for to work with. And we'd love for you to reach out. Again, our in-person, our clinic is Novera Headache Center. NoveraHeadacheCenter.com is our website. If you're out of state, book a virtual free discovery visit. If you're in state, you're also welcome to book a virtual free discovery visit if you don't want to come see us in person. But come see us in person, and let's get the ball rolling. We find that people that listen to our podcast, it clicks, and then realize like, wow, this is different. And this is something I want to take advantage of. Thank you, Dr. Thomas, so much. Yeah, we'll continue to have you on the podcast and dive into topics that, are going to have a huge impact on people's lives. So
we've got a whole list for 2025, so we'll be good.
All right. Thank you all for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. We'll see you next week.